Okay, should we go ahead and get started then? Okay, I just wanted to give enough people the time to log in and settle in. So Amanda, do you want to share your slides?
Yeah, sure. How's that?
Yeah,
come up?
That came up. Okay, so we have Amanda Slinger, who's going to start us off on our first set of sleep talks for you tonight. She's a sleep coach for women. She's the founder of Sleep Spot. She has a background in nursing with a bachelor in science and postgrad in health and safety. She specializes in coaching to women to achieve uninterrupted sleep. So with that, we'll let you get started.
Thank you. So yeah, welcome everybody. This is super exciting. It's the first time that the Sleep Divas have actually hosted an event like this. We've done a lot of talking within different platforms together, but this is the actual first one that we've ever done. So yeah, it's really, really exciting, and hopefully it's the first of many, and perhaps we can build up to a summit at some point. So yeah, we're all going to present on various topics this morning, but I just wanted to kick off just by talking about how uninterrupted sleep is elusive. And I think for many of us, and I think there's a few doctors in the room, our patients really struggle to achieve, that quality sleep that really moves the needle on our performance and also on our well-being. And particularly for the work I do, that sort of well-being piece is really important for the women that I work with. And as we journey through life, at times we may sleep well, and at other times not so well, and times really, really badly, which happened to me a few weeks ago. And also, just because at some time we might be a good sleeper, we might not prioritize our sleep, and our behaviors may not support our sleep. So there's so much to unpack around sleep. It's not just about how to get a great night's sleep, and if I am a good sleeper, am I optimized? There's also that behavioral piece around what am I doing that can optimize my sleep. So I'm just going to start flicking through my slides. So I'm kicking off, and I'm discussing the circadian rhythm. I'm going to introduce that, and specifically what happens in the morning. Then Nishi is going to follow me with what happens in the daytime with our circadian rhythm. Val is then going to follow on with the evening, and Samida is going to cover the night. And of course, we're going to be talking more broadly about other aspects of sleep, but this circadian rhythm is going to be our journey through the next hour as we explore our sleep-wake cycle. Yeah, we'll just take a look at what influences our circadian rhythm. And also for me, well, for my talk, I'm going to be talking about the pillars of sleep. So when it comes to sleep, we all want to put our head on our pillow at night and wake up in the morning feeling refreshed, recharged, and what many people say, their A game, and that's when we're really performing at our peak. But so often this uninterrupted sleep is elusive, and we struggle to achieve this quality sleep that moves this needle. And I believe, and I'm sure, well, I know my colleagues here today and many of you in the room will also understand this idea that sleep is a fundamental life skill, but it's not something that we're taught in school or university or college, unless of course you're going through sleep medicine or some sort of study. So it's not something we're taught. We learn about diet and we learn about exercise, but we don't learn about sleep. And I've got a 13-year-old son, and I remember in primary school him coming home and talking about, you're learning about what's a healthy diet and the 5 food groups, but there's absolutely nothing that is taught about sleep. So it's a skill, it's a fundamental skill that we need in life to really enjoy our life to its fullest, but it's not something that we're taught. So with my colleagues here today, we're going to help you better understand what influences our sleep and what we can do to optimize our sleep. And yeah, if any of my colleagues want to pitch in at any point, please welcome. And I think everyone else is muted, but I'll let Val do that sort of admin side of things. So what makes us sleep? And this is a really interesting topic for many dinner table conversations when people hear that I'm a sleep coach. And we all know that, you know, our desire or that urge to sleep builds up in our body as we're awake, and it increases. So the longer that you stay awake, the more sleepy you feel, and it reaches a low after you've had a good night's sleep. But there are many things that impact our sleep, but I'm going to be talking about two central drivers of sleep. And they are, well, the first one is adenosine, and Nishi will be talking about this in a bit more detail, I think, in her next presentation. But it's a chemical in our body that builds up the longer that we're awake. And after about 10 or 12 hours being awake, it's making us feel sleepy and tired. And because the adenosine is parking in our sleep receptors in our brain. And it's interesting that it's this adenosine that caffeine blocks. When we have a cup of coffee, it blocks the action of adenosine for a period of time, which I'm hoping is happening right now after having just had a coffee. So I won't go on about the adenosine, but that's one of the things that influences how sleepy we feel, and Nisha will touch on that a bit more. But the next one, which we're going to talk about continuously through this next hour, is the circadian rhythm. And that really determines more around when we want to be asleep and when we want to be awake. But it has many other impacts on our body. And some of those are our metabolism, our hunger patterns, our hormones, our energy levels, and of course, our alertness. So it's not just about sleep and wakefulness. And it's controlled by a clock inside our brain, which sends a signal that generates alertness and helps keep us awake and alert. And as night falls, it initiates the production of melatonin, which promotes sleepiness, and it keeps transmitting that sleepy signal throughout the night, which keeps us asleep. I realize I'm going to have to speed up a little bit. But let's just go back a little bit. Every organ and cell in our body is controlled by natural timing devices, which I'll call here biological clocks. And these clocks regulate all aspects of our physiological processes and functions. So body temperature, hormones, menstrual cycle, which Val, I think, is talking about a bit later too, blood pressure, sleep timing, and so much more. And there's different types of these body clocks. We've got ultradian clocks, which work for less than 24 hours. So our sleep cycle, we cycle through sleep during the night, and each one of those would be an ultradian cycle. And we have infradian cycles, which are more than or longer than 24 hours. And that's, for example, the menstrual cycle with 28-day average cycle. And then we have the wonderful circadian cycle, which is around 24 hours. So, we have all these clocks in our body, but then there's this master clock, which coordinates all the biological clocks and keeps them in sync. And this is located in the brain, and it's called the suprachiasmatic nucleus. So SCN, I keep saying CSN. No, not a news channel, although it's a bit like a news channel, the SCN. And it sets appropriate timing and rhythm, and it communicates with the clocks throughout the rest of our body. And it's a really, really essential function. But the really big question here, and something I find incredibly fascinating, is how does this master clock know when it's daytime and when it's nighttime? So the signal it receives is from our eyes, and it's the light. So the eyes signal the suprachiasmatic nucleus that it's daytime or it's nighttime, and it lets it know when it's light and when it's dark. So when should we be asleep and when should we be awake? And interestingly, and really critically, these clocks, or particularly the master clock, prefers rhythm and consistency. And this is really what we want to be aiming for with our sleep. And the more we change the timing of things that we do, time we exercise, the time we wake up, time we eat, for example, the more we see negative impacts on our health and our performance in relation to sleep. So when properly aligned to the rising and the setting of the sun, your circadian rhythm can promote consistent and restorative sleep, which, is just, wonderful, glorious sleep. But when it's thrown off, which often happens in our lives, it can create significant problems, significant sleep problems, including insomnia. And there's a lot of research around all these things, and Samida will touch on a few of these a bit later. But it plays a huge role, a diverse role in various aspects of our physical and emotional well-being. So it's something to take note of. And once we better understand the circadian rhythm and the variables that can influence, and we can then be better able to manipulate and tweak these variables so that we can align our circadian rhythm and enhance these aspects of our life, our performance, our health, and our well-being. So interestingly, the sleep-wake cycle runs slightly longer than 24 hours, which is something which I found just incredible when I first researched this many years ago. And I'd like to hear from the other ladies later on. The average that I've come across is 24.3 hours. It was 24.5, and now I'm reading it's 24.3. But the important thing here is that it's longer than our 24-hour clock that we work to all across the world. So if left without any cues, so this exposure to sunlight, our sleep time will start to drift later and later, and you'll want to wake up later and later into the wonderful world of the teenager. And that's why it's so important to reset our sleep-wake cycle to a 24-hour schedule each day. And we can do that with exposure to morning light and other behaviours. So how do we reset our body clock, and what influences it? Well, there are three main things. There's light, physical activity, and food intake. And there's many things, but they're the three main things. So light is actually the strongest influence on the circadian rhythm, and it enters our eyes, obviously, not from behind our knees. I've heard so many people talk about, I hear that we can, our body clock can be activated by light behind our knees. And I'm blown away by how many people talk about this. And I know, Andrew Huberman talks about this as well. But it's only through direct light entering our eyes. And what it does, it enters our eyes and signals the master clock in the brain, whether it's day or night, so when to be awake and when to be asleep. But it's not just any light will do. It's important about the right time, type, and the right amount of light. And we can reset and strengthen our natural circadian rhythm by optimizing our daytime alertness and mental well-being by adjusting this type of light and amount of light. And of course, the opposite is true. The wrong type of light and the wrong amount of light can negatively impact our circadian rhythm, causing daytime drowsiness, lack of focus, poor mental well-being, on and on and on. And of course, many people nowadays are exposed to artificial light, indoor light for much of the day, and seemingly more and more. And unfortunately, the type and timing of exposure to this light is not great when it comes to our natural circadian rhythm. So we want to expose our eyes to natural sunlight. So this is the right type of light, and it's unfiltered light through the window, or unfiltered light, so not through a window and not through sunglasses, just because of their effect on deflecting light. And of course, we don't want to look directly at the sun, but even when we're in the shade, I've got a light meter that I use on my phone from time to time just to have a look, and out of my curiosity, just to see how much light I'm getting exposed to. Anyway, this light can be underneath my pergola outside. I'm still getting a really good amount of light. So morning light, when it's low on the horizon, is the best. And I'm going to just speed up because I think I'm going a bit longer. And we want to expose our eyes to this natural sunlight for probably, I'm just going to speed through a few slides here. If I'm to exercise, sorry, go back a slide. At least 10 minutes in the morning. For me, I'm in Australia. We're coming into summer. It is incredibly sunny. So for me, 10 minutes is probably going to be sufficient. But if you're on a cloudy day, it's perhaps 30 minutes or longer. And if you're in the Northern Hemisphere where it's very, very dark at times of the year, you may even need an artificial type of light to activate that body clock and let it know that it's actually daytime and we should be awake. So the other influence I wanted to talk briefly about is exercise. Is there an optimal time to exercise? And really the answer is it depends on what you want to optimize. If it's your sleep-wake cycle, then early morning is the best because it's going to support that rising body temperature, which influences the timing of our circadian rhythm and when we want to be awake. And temperature is so critical to aspects of the timing and quality of our sleep. When our body temperature is falling, it sends a signal for us to fall asleep, and the opposite happens when we wake up. So there's a fascinating part of the neuroscience behind early morning as well, and it's all about priming the brain's dopamine system for this go mode, and it results in us having this high level of motivation and alertness. But it can also bias our central nervous system to waking up early. So it's just another important thing to consider. Habit stacking, just very briefly, when it comes to the morning routines, habit stacking is a really wonderful thing to be doing here. And this is about, the more you do something, the stronger and the more efficient the connections become. And you want to take advantage of these strong connections to build new habits. So, for example, early morning sunlight. I go outside in the morning, I have a cup of tea, I get some sunlight, I enjoy my cup of tea. It's a habit, but I'm now getting the habit stacked with getting that exposure to the early morning sunlight. If I go for a run, I'll do it in the morning. It'll increase my body temperature. So again, to really influence that body clock and that temperature rising, but I'm also going to be getting some sunlight. So I take my sunglasses off as well. So I think I'm just about through my slides here. Takeaways very quickly. Did I just show them? Did I? No, I didn't. I don't know where I put them. I don't know what's happened to my slides. There we go. Sorry, I was on the wrong one. Takeaways, understanding your circadian rhythm and peak performance and well-being. So understanding your circadian rhythm for peak performance and well-being. Exposure to sunlight is really, really critical to that. Exercising, habit stacking, and I'm not sure what happened to my regularity slide, but somehow that went by the by. But nonetheless, I'm going to finish there. Thank you very much. And I'm going to hand over to Nishi. I'm just going to let you share your slides, Nishi. And I will do a quick introduction. Sorry if I went over, ladies. I'm not sure what time we got started.
Okay, great. Thank you, Amanda. Can you see my slides here?
Yeah, I can indeed. So yeah, welcome Nishi Bhopal. Nishi and I met, it was over a year ago, and we've been, then we created this Sleep Divas group, which has been such a powerful group. But yeah, Nishi is a board certified, she's board certified in psychiatry, sleep medicine, and integrative holistic medicine. She's also the founder of Intrabalance and the founder and medical director of Pacific Integrative Psychiatry. And she's based in San Francisco. So welcome, Nishi.
All right, thank you, Amanda, and thank you for that great presentation. And we both talk about the importance of light all the time, and I'm obsessed with getting that morning bright light. And I'm sure my patients are sick of hearing me talk about morning bright light, but I just wanted to emphasize that is one of the most powerful things you can do to actually reset your sleep-wake cycle and help improve your sleep quality. So in this portion of the presentation, I am going to be talking about sleep and mood. And just a quick disclaimer that everything I'm presenting is information only and is not medical advice. So here is what we're going to look at. We are going to understand what happens to your circadian rhythm during the daytime. Then we're going to talk about sleep hunger and naps and the optimal way to take a nap. And then we're going to look at the relationship between mood and sleep. So as Amanda spoke about, the circadian rhythm affects a multitude of physiological processes, including our sleep-wake cycles. but it also affects our metabolism, our hunger patterns, our hormone secretion, our energy levels, our blood pressure, our body temperature, as Amanda was just speaking about. And you can see that sort of illustrated in this graphic here. And you can see how, as you go across the clock, I don't know if this is too small to see, but we have our highest levels of coordination and reaction times earlier in the day. Body temperature is at its peak during the day, so is blood pressure. But then as the evening sets in, melatonin is secreted. We go into deep stages of sleep. Core body temperature decreases further. And then in the morning, we get a nice rise of cortisol, which helps us wake up and feel more alert. And that is largely related to light exposure again. So that is the circadian rhythm throughout the day. So another aspect that the circadian rhythm affects is our levels of alertness. And you can see here in this graphic how the circadian rhythm sort of fluctuates throughout the day. So you can think of the circadian drive as your alertness signal or your alertness drive. So our circadian rhythm is at its peak in the morning, and then there's a bit of a trough in the afternoon where we get this mid-afternoon dip. So a little bit of a dip in alertness. And that's totally natural. We've all probably experienced that in some way. And this usually happens between 2 p.m. and 4 p.m. So this might be when you crave a little bit of caffeine, maybe that second cup of coffee or third cup of coffee for the day, or you might see that the lineup at Starbucks is around the corner, usually around 3 p.m. That's because of this mid-afternoon circadian dip. So keep this in mind because we're going to come back to this idea in a few minutes. But I just wanted to quickly talk about sleep hunger, also known as our sleep drive or sleep pressure. So as Amanda had mentioned, the circadian rhythm is one process that regulates our sleep-wake cycle. It's also known as process C for circadian. But the other process that interacts with the circadian rhythm is our sleep drive, also known as process S. And you can see in this illustration that the longer we're awake, the more sleep pressure builds up. So the sleep drive gets stronger, or sleep hunger gets stronger. And then as we sleep, that sleep drive goes down, and then we're awake and the sleep drive goes up again. And you can just see here in this illustration that if you don't go to sleep, that sleep pressure keeps building up. So the sleep drive is essentially your likelihood of falling asleep at any given time. So the higher your sleep drive is, the more likely it is that you're going to fall asleep. And then the longer you stay awake, the stronger your sleep drive becomes, or the larger your sleep hunger becomes. And this is counterbalanced by the circadian rhythm, which is your alertness signal. So that's why you might get a second wind, even if you're very sleep deprived or your sleep drive is very strong. The circadian rhythm can kick in and give you a bit of a second wind. And as Amanda had alluded to, much of this is driven by adenosine. So adenosine is a neurotransmitter that is a byproduct of metabolism by your body's cells. So the longer that you're awake, the more adenosine your cells are producing, and the sleepier you're going to feel. And adenosine primarily works or affects areas of the brain that are involved in wakefulness. So as we've looked at, the longer you're awake, the more your adenosine builds up, and then your sleep drive builds up. And as Amanda also mentioned, caffeine actually blocks the adenosine receptor in the brain. So caffeine has a very similar chemical structure to that of adenosine. So it can go in and bind to that adenosine receptor and block adenosine from telling your brain that you're sleepy. But what happens is that the adenosine keeps on building up in the background. So when that caffeine wears off, you get this influx of adenosine. And that's why you might feel even more tired, especially if you're someone who's accustomed to drinking a lot of caffeine. You might notice that you need more caffeine to stay awake and alert because that adenosine is building up, particularly if you are not getting enough good quality sleep. So as we looked at, when you sleep, your brain and your body is able to wash out some of that adenosine. And this also happens during naps. So if you take a short nap, that's going to help clear out some of your adenosine and reduce your sleep pressure or your sleep drive. And some cultures actually take advantage of this mid-afternoon circadian dip, where you might have a siesta built into your daily routines. And we don't really do that here in the US or in Canada or, most sort of westernized countries. But I mean, I would be a huge fan of bringing the siesta back into our daily routines, because we know that naps are really good for cognitive performance. So I actually gave a talk to a group of air traffic controllers a few months ago, and naps are a huge safety issue because strategic napping is shown to help reduce fatigue and errors and can improve cognitive performance. And large companies are starting to take note. So companies like Google, NASA, Ben & Jerry's, Huffington Post, they all provide nap rooms to their employees, not just out of the goodness of their hearts, but because they know that napping actually improves productivity with their employees, and that actually improves their bottom line. So one of the questions I get asked all the time from my patients is about napping and what's the best way to take a nap? Should you take a nap or not? So here's a really quick and easy algorithm that you can use to kind of optimize your power nap. So the ideal amount of time for a power nap, there's different kinds of naps, but I'm talking about power naps here. The ideal amount of time is about 10 to 20 minutes. Any less than 10 minutes is not really shown to be that effective, especially when we're talking about improving cognitive performance. More than 20 minutes can be tricky because then you can actually start to get into deeper stages of sleep, and you might wake up feeling more fatigued, more groggy. You might experience what we call sleep inertia, where it's kind of hard to get up and get going. And this could also potentially affect your sleep at night. So 10 to 20 minutes is ideal for a power nap. The ideal time for a nap is before 3 p.m. So remember that circadian dip was around 2 o'clock, 3 o'clock. So ideally around 1 o'clock or 2 o'clock is great for a quick power nap. Taking a nap too late in the afternoon, so after 3 p.m., could potentially affect your ability to fall asleep that night. And then if you struggle with insomnia, napping is a no-go because it's going to reduce your sleep hunger. It's going to reduce that sleep drive. And so if you're struggling with insomnia, you want your sleep drive to be maximized. So it's going to be easier for you to fall asleep and stay asleep. So if you have insomnia and you're napping, it's kind of like having a snack before dinner. It's going to reduce your hunger for sleep when bedtime comes around. So let's talk about the relationship between mood and sleep. Most adults need somewhere between 7 to 9 hours of sleep at night. And there might be some variation there, but on average, 7 to 9 hours is ideal for most adults. But there was a study that showed, and this is from the CDC, that showed that less than 2/3 of women actually get that amount of sleep on average. And this is problematic for many reasons, but it is especially problematic when we're talking about mood, because there is a bidirectional relationship between mood issues and sleep problems. So what this means is that anxiety and depression can contribute to sleep issues, but sleep issues themselves can increase the risk of anxiety and depression. And there was a study out of the University of Michigan that showed that people with insomnia are 4 times more likely to develop depression than people who don't have insomnia. And furthermore, they showed that for people who have depression that has been successfully treated, they're more likely to relapse into symptoms of depression if they experience insomnia, even with adequate treatment. And then as far as anxiety, people who have sleep issues are more than twice as likely to develop an anxiety disorder. Conversely, 80% of people with anxiety disorders experience difficulties with insomnia. And this is especially important for women because women are more likely to have sleep problems than men. And the 3 most common sleep disorders are insomnia, restless leg syndrome, and obstructive sleep apnea. And women are more likely to develop 2 of these, which are insomnia and restless leg syndrome. There is also a higher risk of developing sleep apnea after menopause. And we'll talk about sleep apnea in women in a moment. But I just wanted to briefly touch on the nervous system as well, because this is relevant to both mood and sleep. So there are two primary aspects to the autonomic nervous system. There's the sympathetic, which is the fight, flight, and freeze response, and then the parasympathetic, which is your rest and digest response. So as you can guess, the parasympathetic nervous system is what is dominant during sleep when we are resting. But the problem is that most of us are in sympathetic overload. We're in sympathetic dominance during the day because we're just so active and we're so busy, and many of us are dealing with chronic stress. And so when you're in a state of sympathetic overload, that overactive nervous system is going to affect your ability to fall asleep and stay asleep at night, and is also going to affect your sleep quality. It's also going to increase your risk of anxiety disorders and mood disorders. So what do we do about this? How can you optimize your sleep? Or if you're struggling with insomnia, what should you do? So the first step is to assess any underlying causes for the sleep issues. And so, as I mentioned, restless leg syndrome is very common in women, especially in women who are menstruating, because menstruation can lead to loss of blood, which leads to loss of iron. And low iron is associated with the symptoms of restless leg syndrome. So you can do a simple blood test if you're struggling with restless leg syndrome. So feeling like you have an urge to move your legs at night, or feeling creepy crawlies in your legs, or you have to wiggle your toes, or you just can't get comfortable, or if you feel like your sleep is just disrupted, it is worth checking your iron levels, and that can be done with a simple blood test. So you want to check iron and ferritin. So I recommend to my female patients to get this blood test done, and I check this in a lot of my patients. Now, I talked about sleep apnea. So in men, sleep apnea can show up as loud snoring. There might be some snorting during their sleep, or very obvious episodes where they stop breathing or they wake up gasping. In women, it can be a lot more subtle. So sleep apnea is often underdiagnosed in women because the symptoms might look like chronic fatigue. It might be misdiagnosed as insomnia. It might be misdiagnosed as depression. So especially if you are postmenopausal, or if you're seeing patients who are postmenopausal, do consider sleep apnea in those patients if they are struggling with sleep or chronic fatigue. Now, I've seen sleep apnea in my younger patients as well, patients who are young and maybe very thin or very athletic and very active, patients in whom you might not suspect sleep apnea, but they've come to me with depression and fatigue, and we did a sleep study and they had sleep apnea. So do consider this in your differential. And then you also want to consider circadian rhythm misalignments. So we've talked about your internal body clock and your natural rhythms. And if your natural internal rhythm is misaligned with your daily obligations and your daily routine, this can lead to issues with sleep and energy. The next thing is to address stress during the day. So we looked at the parasympathetic and the sympathetic nervous system. And a lot of patients will tell me that, I did my 10 minutes of headspace meditation before bed and it didn't work. Well, the reason it didn't work is because if you're in sympathetic overload all day long, you're like a high-speed bullet train, and now you're trying to come to a complete stop with 10 minutes of meditation, that's just not going to be very effective. So what you want to do is slow things down during the day. So by the time it's bedtime, you can kind of just ease into sleep and not try to come to a complete stop. So what I recommend is during the day, focus on calming your nervous system by building in breathing practices into your daily routines, or doing stretching throughout the day, or practicing mindfulness as you go through your day. And it doesn't have to take a lot of time, but it can have a great impact on your stress levels, calming your nervous system, and then helping improve your sleep quality. For people who are struggling with insomnia, I highly recommend looking at Cbti, which is cognitive behavioral therapy for insomnia. So Cbti is the gold standard treatment for insomnia. It is effective for both sleep and mood. So studies show that it can help to alleviate symptoms of insomnia, but also symptoms of depression. So if you're struggling with mood or depression, along with sleep issues, Cbti could provide relief for both. And this can be done online. You don't have to necessarily do it one-on-one with a psychologist who's trained in Cbti. There's lots of different online programs and apps and things that you can do virtually. So if we have time at the end, if anyone's interested in those resources, we can talk about that. And Amanda was talking about exercise. So moving your body is great, of course, for your physical health and for your mood and for your energy levels. Staying active during the day helps to also build up those adenosine levels. So that helps to increase your sleep drive and your sleep hunger, so that when you're active, you can have an increased sleep hunger and then be able to fall asleep more easily and stay asleep. So we have looked at what happens to your circadian rhythm during the day. We looked at sleep hunger and how to optimize your power nap. And then we looked at the relationship between sleep and mood. So thank you for your attention. If you're interested in learning more, I've got more information on my website at intrabalance.com. And I've also got lots of videos on mental health and sleep. And then up next, I'm going to stop my share here. Up next, we've got Dr. Samida. And Samida, do you want to share your slide deck?
It's going to be Dr. Val.
Oh, I'm so sorry. Dr. Val is up next.
No worries.
Okay,
There
Dr. Val.
Good evening.
So great. So Dr. Valerie Cacho is an integrative sleep medicine physician. She is the founder of Sleepforia and the founder of Sleep Life Med, which is her telehealth sleep practice in Hawaii and California. And she has a special interest in women's sleep. So I'm really excited to hear her talk because she's going to be talking about the impact of hormones on our sleep quality. So over to you, Dr. Val.
Thanks so much, Nishi. Can everyone hear me okay? So let's just take a quick break, a stretch break. Yeah, we've probably been sitting for about 40 minutes. Thanks for everyone staying here and having your focused attention. So just a little disclaimer, as Nishi also mentioned, I am a medical doctor, but in this role, I'm not your doctor. We're just providing education about sleep. So thanks for joining us here today. Yeah, and I love that overview. I am definitely a big napper. I would love any opportunity to nap. So yeah, that should be incorporated. And I did take a little 5-10 minute break earlier today because I didn't leave the office to get lunch. So otherwise I could just sit straight through 8 to 10 hours. So definitely moving your body is really helpful, especially if you can go outside, get sunshine as well. Thank you so much, Amanda. So my outline, I'll talk a little bit about evening routine and then go into talking about women's hormones, and then talk a little bit as well as Nishi spoke about some of the women's sleep disruptors, restless leg and obstructive sleep apnea, and then really focus on what strategies, so you heard a lot about, the background of sleep, some medical sleep conditions, but what can we really do in our evening time to help improve our sleep? So recommendations for developing an evening routine: set an alarm. I don't know if you've heard this before, and we probably been trained pretty early on that we should have a wake up alarm or a bedtime alarm. I know when I was little that person was my mother that would wake me up in the morning time, but it was probably not until recently that I've decided that it is important to start a wind down routine and actually set an alarm to actively remind myself to do so. And I do have a smartphone, and you can actually do that on your phone as well, where you can set a time when you're wanting to go to sleep, and that your phone will actually change into the night mode as well, which can help dim some of that light and give it that amber hue. So dimming the lights is also really important. Amanda and Nishi did speak of this. We don't want to have too much light exposure, especially the blue light at night, right? Because that can diminish the release of melatonin from our pineal gland. And I love how Nishi talked about, or Dr. Bhopal talked about how, we're sort of on this speeding bullet train throughout the day. I know that definitely resonates with me. But how can we create a calming ritual? I believe Samida is going to talk about medications, but do we need to grab a medication, right? Can we train our brain to develop that parasympathetic response, improve that calming routine? And definitely yes, and that's something that I teach my patients on a regular basis. And then go to bed, right? So set an alarm, dim the lights, create a calming ritual, and then actually lie down and go to sleep. all possible to do so. So just some examples here. For some people, who have a pretty active mind, I recommend journaling, whether it be a worry journal, a to-do list. I do recommend to do this, earlier in the evening, probably not too close to bedtime. Otherwise, maybe it'll start stimulating your thoughts. But a good analogy is, what do you do with all the files you no longer use in your computer? Well, I don't like to have multiple files drifting on my desktop, so I love to pull them into the trash. And actually, one of my favorite things to do is actually clear out the cache and get rid of that, right? Can increase your RAM, allow for more headspace. And that, your brain also works a little bit similarly. So get rid of all those thoughts. For people who have thoughts that are, really ruminating, maybe create it as a ritual. So write down the thoughts, crumple it up, throw it in the trash can, or actually burn it, or even flush it down the toilet. Really, really just get rid of it. The next picture, tea, right? It's starting to get cold. It's definitely not cold here in Hawaii yet, but I see a lot of pictures of fall. And so when I used to live in California, I love to have, an evening warm cup of tea, especially when it was cold. There are certain teas that have calming properties. Chamomile is certainly one of them. But it's good to have, that, or I think that ritual, after dinner, have a tea, read a book, spend some time with your family. Some people, maybe it's listening to music. Music really can affect our emotions. So, a calming music, or even maybe a podcast in the evening time to help transition you from, work, family time, and getting ready for bed. Stretching exercise, there's a whole form of yoga called restorative yoga, where your body is just in the utmost relaxing position. I think that's really conducive for sleep. And also prayer and meditation, having that quiet time, connecting to a higher power, I think is, definitely important and can be a part of your evening ritual. Oh, this one is, I think, probably the hardest one. And I dedicated its own picture and slide to it, right? Turn off your phone, turn down your phone. The next week will be my last week associated with a hospital. And so for, I'm not sure how many years now, I've actually had to keep my phone next to me, because as a medical director of a sleep lab, if anything happens to the patient in the middle of the night, then they do need to call me and ask for any orders or anything. So very looking forward to this, where I can actually turn my phone in airplane mode, where I won't get calls, won't get texts, even actually turn my phone off. So I do recommend, if you have the ability to do so, turn off your phone or put it in airplane mode. This picture was just, at her bedside, but some people actually put their phone in a different room, right? And so, do you really need your phone within fingertips reach with you at all times? If you do need to have a clock, you can buy an old alarm clock just to look at it, but certainly I don't recommend clock watching specifically for people who have insomnia, because then sometimes that can create a negative feedback loop if people get frustrated that they're not sleeping. So something to keep in mind, if at all possible, move your phone, to a different part of the room. Another thing with the phone is that, it's so rewarding, I think, whether it be text, going on social media, or even reading, something in the paper, right? There's a lot of alertness that comes associated with the phone, and maybe even a reward type system. And that's probably something that's the opposite of, promoting sleep or promoting good sleep. So some things to consider, whether or not it's the phone itself, or the apps and the connection that you have to the phone. So if you don't need it, if you're not on call, consider put it in another room, and maybe do something simple. Maybe just one day out of the week, put the phone in another room and see how you feel and how well you sleep at night. Center for Sleep Deprivation, right? And that just goes on to making sure that you stop getting exposure to light. I recommend for patients an hour prior to their desired bedtime, but you got to find what works for you. First to admit that sometimes I am on my phone. Sometimes I am answering last minute emails up until I need to go to bed. And one thing is, give yourself some grace. No one is a perfect sleeper 100% of the time. And you've got to find out what works for you within your lifestyle. Maybe it's easier to cut off your phone, an hour on the weekends versus during the week if you need to do emails. Going on to talk about hormones. Hormones are messengers. So there's signals that talk from, different parts of your body, whether it be your brain down to your ovaries, to the different adrenal glands. But yeah, hormones are messengers within our body. And what are the specific hormonal changes that happen during the menstrual cycle, right? So going back, I had to review this a little bit because it's been a while since I talked about gyne with patients. Usually I just talk about sleep. So during the ovarian cycle, right, we have a developing follicle, and there's hormones that are associated with that. FSH is follicle stimulating hormone that usually it increases when our estrogen and progesterone levels are low. So I'll put my cursor here. So estrogen levels are low. And then there's also the uterine cycle, with this, the endometrium, which actually, supports birth. So if we're menstruating, really what we're doing is we're trying to procreate, right? So during the follicular phase, the follicle is developing, and then ovulation happens, right? So the egg gets released, and if there's sperm around, then ideally it'll get implanted in the uterine lining. So it's really interesting because progesterone levels tend to rise during the luteal phase, and what research suggests is that during the luteal phase is that women want to take more naps. And why is that? Well, if you think about what's going on within your body, right, progesterone is progestation. So if your body is prepping to implant an egg, right, you want to reserve all that energy for that, and that's potentially why women are more sleepy during that time period. And then with the follicular phase, we see women who have more poor sleep quality, and that's been suggested due to lower levels of estrogen and progesterone, which have been associated with poor sleep. Yeah, so that's the menstrual cycle. And moving on to perimenopause and menopause. So as we get older, right, our bodies say here, I guess evolutionarily, we don't need to have kids anymore. So we start to become infertile. So the ovaries, the follicle number actually decreases. And so with that decrease, right, estrogen is made from our eggs, those levels start to decline. One question that sometimes I get as women go through perimenopause and menopause is whether or not we need to check these level of hormones. And I'm certainly not a gynecologist. I would defer the that discussion to them. I mean, if you are on hormones, I think it'd be, wise to check, what the hormones that you are taking is, how it's affecting your levels. But what we do know is menopause is defined as 1 year without having a period, and that's typically when the estrogen progesterone levels are very low or potentially even undetectable, and then FSH levels are high. And it's really interesting because what does the sleep data show with the hormone levels? And from what I can tell from subjective studies, it talks about the change in FSH levels. So early on, right, there's early menopause and maybe even late menopause, that we tend to have more sleep disruption as the hormone levels are changing more frequently. But it's really interesting, and that was from subjective data, when we actually took women and we did samples of their hormones and we studied them in the lab, that even though the FSH levels were high, they didn't necessarily have the disruptions in their sleep through the different stages of sleep. I mean, they had enough slow wave sleep, they had enough REM. So what it goes to show me is that, maybe hormones can play a role. Sometimes, right, our changing hormones can be involved with symptoms such as, hot flashes, dryness, pain on intercourse, mood instability, irritability, joint pain, but it may not explain the whole story. And I'll talk about a little bit later all the different disruptors that can affect a woman's sleep. And specifically talking about some of the sex hormones, is estrogen helps with growth hormone, can help with glucocorticoids, prolactin, and melatonin. Then progesterone has some sedative effects, right? And so we see that during the luteal phase. And it's also interesting that small studies do show that, progesterone may help stimulate our breathing. And they try to see if giving someone progesterone can help with treatment for sleep apnea, but it didn't quite pan out. Someday someone really smart's going to come up with a pill to treat obstructive sleep apnea. Not quite there yet. And then follicle stimulating hormone. So it's a marker for ovarian age. And so what I was talking about is that the rate of change of FSH has been associated with sleep disturbance, a subjective standpoint. So sleep disruptors for women, one or ones do you have? So, sometimes women, if they're still menstruating, have a hard time sleeping because of abdominal cramps, right? Some back pain that's associated with it. As we get older, as we go through perimenopause and menopause, hot flashes, I would say, is right up there as one of the common reasons why someone has difficulty sleeping. The next, probably depression, anxiety, some ruminating thoughts. Amanda and she talked about circadian rhythm and chronotype issues. Are you more of a night owl trying to sleep a little bit earlier? And then sleep apnea, I definitely see a lot of women who have undiagnosed sleep apnea. And that's the whole thing. It's so interesting how presentation for certain medical conditions for women are different than men. When men have heart attacks, it's that crushing elephant, that squeezing, they're diaphoretic. But when I was working as an internist, we've had people who came in because they were nauseous and they were dizzy. And then we did the blood work and we did the EKG, and yep, they were having acute, heart attack. So women are a little bit different, and I think that the symptoms that are presented, shouldn't be minimized. Restless leg syndromes is more common in women who go through pregnancy. Our environment, our diet plays a role. The next slide, I think I'll talk about doing a sleep diary. But right, when are you exercising? When are you having, that last glass of wine or that last cup of coffee? How is that affecting the quality of sleep that you have at night? So my tips for my strategies for getting better sleep is one is really evaluate what's going on with your present routine. Um, now, are you on high alert all the time? Have you hit the Control Alt Delete button throughout the day, the pause button? Have you spent time outside in nature, getting sunlight during the daytime hours? And then look for any potential sleep disruptors. I know it was a lot of internal things that I was mentioning here, but what about the external things, in terms of bed partners? As women get older, their partners are also getting older. So maybe they're developing sleep apnea and snoring, and that's affecting your sleep. Or maybe the pets are getting older and then they can snore. My brother actually had a dog that would snore quite loud. Pretty sure it had sleep apnea. The next step I recommend is complete a sleep diary, right? So if we're focusing on behavior change, one of the best ways to do so is through bringing out self-awareness. So really understand what we're doing. And then step 3 is incorporate a calming ritual. So this is a sleep diary that was created by Athleto Well. And I think it's really helpful because it takes a look at different aspects of your body that we may not always think about is, well, what's my mood? How am I actually feeling? Am I going to bed angry, or am I going to bed, happy, or is something on my mind? And how would I rank my level of stress, right? Stress definitely can affect the quality of one's sleep. Caffeine, how late in the day did you drink caffeine? I know personally for me, I've got it down to almost a science now where I can have decaf coffee in the morning. If I have a full cup of regular coffee, then I will be up all night. Even if I stop at noon, I can have one black tea bag. If I have 2 black tea bags, then I'll be up at night. So sometimes you need to do your own little experimenting to figure out, how much can your body tolerate. Exercise, did you work out? And if so, what time? How much time did you spend outdoors? Were you exposed to light? And in the morning time, maybe consider how much hours of sleep that you get, and then look at, how you spent your day previously, and did that play a role? And then how do you feel in the morning? I don't think we talked about sleep trackers, but it's so interesting that, sometimes people come in and show me their sleep tracker, and they have 20% of restless sleep one night, or a lot of light sleep, or a lot of awakenings. And I say, well, how do you feel in the morning? Well, I feel okay. So yeah, your subjective experience of sleep is also really important. And I always encourage them, don't let a company X, Y, or Z tell you how you feel, right? Your thoughts and your feelings really. So just some more pictures here. Sometimes people will ask, well, what do I do if I wake up in the middle of the night and I can't sleep, right? Because you tell me not to be on my phone or not watch TV. Well, write things down, journal. Knitting. Knitting's a good exercise. That's something that you can do, not too much light, or maybe light a candle. Just have a ritual. And then I actually heard this from a friend. It's adult coloring books, but also this Zen drawing, focusing on those different brush strokes, I think is really calming for the nervous system. So thank you for your time. This is one of my favorite quotes by Rumi. What is planted in each person's soul will sprout. So I like to think of, hopefully I'm just planting seeds maybe it's something that you haven't heard before, or you have heard, and then maybe, later it'll flourish into something beautiful. Yep, I'm Dr. Val or Valerie Cacho. You can find me on Instagram or TikTok, and these are my websites. I'm going to stop my share, and if Samida wants to start, or if you want me to share, just let me know.
I think it worked, right? Can you guys see my screen?
Wonderful. Yeah.
Okay,
Looks
great.
good. So our last but not least, our final speaker for the evening is Dr. Samida Patel. She's a triple boarded physician in neurology, sleep medicine, and integrative medicine. She's the founder of iNeuro Institute, which has an excellent newsletter. If you haven't signed up, I do encourage you to do so. She is quite busy. She's also the CMO of Sleep and Wellbeing at Dr.pedia, and also she's the president of the Illinois Neurological Society. Take it away.
Great. So the final talk for tonight, and as we enter the night, hopefully no one has actually fallen asleep yet. I'll be providing information on how to get better sleep and an indirect result, maybe even memory. So, okay. So I'm Dr. Samida Patel, and so we're going to try to talk about getting better sleep and, like I said, indirectly some memory. Why is sleep so important for the brain? The brain is so rich in oxygen, and also it has toxins which can damage the brain. And there are antioxidants that come out when you sleep. And so these antioxidants start cleaning up, and you have this built-in buddy system working for you when you're sleeping and, of course, getting good quality sleep. So ideally, when someone sleeps, ideally, when someone sleeps, we encourage, what happens is you sleep in cycles. And so when you first go into sleep, you start out in this light sleep, and you move on into deeper stages of sleep. And so ideally, a cycle lasts about 90 to 110, 120 minutes, and so there's physiologic processes that are going on when this happens. So we start out in stage 1 sleep, which is like a little dozing off, easy to wake up from this stage of sleep. And so if an alarm went off, you would be easily woken up. As you go into a little bit deeper sleep, or as we call it, stage 2 sleep, the body enters a more subdued state. And that kind of includes like some heart rate lowering, and your temperature will kind of drop a little bit as well. Your muscles will kind of relax, and so you might even have slower breathing. Then as we move on to deeper stages of sleep, what we call stage 3 sleep, also known as deep sleep or slow wave sleep, it's harder to wake someone up from this stage of sleep. Of course, again, physiological changes are happening. Things like our muscle tone, pulse, breathing rates start decreasing, and the body relaxes even further. There is evidence that when we get into deep sleep, that this will contribute to things like insightful thinking, creativity, and improving your memory. So you do want to get into this deep stage of sleep, because this is where some of that memory pruning will kind of happen. And then during REM sleep, there's brain activity that picks up. So if anyone were to go through a sleep study, we put these electrodes on our brain, and so we can see the different stages of sleep that happen. And so when we put electrodes on your brain during REM sleep, it looks as if someone's awake, but clearly not exactly like someone's awake, but a lot like it. But also what's happening is that there's no muscle tone. So the body experiences atonia, And this is a temporary paralysis of the muscles with two exceptions. Your eyeballs still move, and your diaphragm, the muscles that control your breathing, are still moving. And so the eyes are closed, and if someone was staring at you when you're sleeping, you'd be in the stage of sleep, in REM sleep, you'd be able to see the eyeballs kind of moving. And that's where it gets its name. REM stands for rapid eye movement. And so REM sleep is also believed to be essential to cognitive functions like memory and learning. And REM sleep is also known for more vivid dreams, which is explained by like a significant uptick in that brain activity, like I talked about. And then people always ask about dreams. So dreams are probably likely to occur in any sleep stage, but they're probably more common and more intense in this REM period of sleep. So what affects sleep stages? What if someone doesn't go through all the stages or something like that? Could that happen? Well, of course it could. Well, there's a typical pattern for sleep stages, and ideally we like you to go through 1, 2, 3, and then REM sleep, but if a person doesn't get regular or sufficient sleep, let's just say Monday through Friday, and then, you kind of crash Friday night, then we might see different stages of sleep, different amounts in different in these stages. So like you might not move so quickly from like stage 2 to stage 3, et cetera. So I'm just trying to give an example that we might see something like that. Alcohol, other drugs, other medications, can of course alter sleep stages as well. And then you've kind of heard about sleep apnea and restless legs. And, these kind of sleep disorders can also contribute to an interruption of a healthy sleep cycle. So sleepers who are frequently awoke during early stages, such as people with sleep apnea, may struggle to properly cycle through into these deeper stages of sleep, because when you're not breathing, you can't allow yourself to get into that deep stage of sleep. You kind of alert your body, you're not knowing you're doing it, but your body gets alerted and kind of wakes up and starts to try to drift off back to sleep. So especially with sleep apnea, we can easily see that interruption happening. So again, when we put electrodes on your head, we're getting all that kind of information. Here, again, we struggle with not getting enough sleep. And in fact, the CDC has said about 8% of American adults report using a sleep aid at least 4 times in a week. So doesn't sound like a lot, but 8% of Americans, but the frequency of using it is quite a lot. And so sleep aids include not just prescription medications, but a lot of things are over the counter. So over the counter sleep aids, things like the Tylenol PM, the Benadryl, the NyQuils, and then of course the dietary supplements too, which are labeled as the natural sleep aids. So some people may even reach for alcohol to help them sleep. Alcohol, of course, decreases certain stages of sleep. So maybe something like REM sleep may be decreased if you're drinking alcohol. But as the alcohol wears off, then you tend to wake up and you don't have as good of a night of sleep the rest of the night. So not maybe a great sleep aid, of course. And I have to say also that it's impossible to probably choose the best sleep medication for all situations and for everybody. Like I can't just say, go take this today, tonight, because it's going to work. When a sleep aid is needed, the optimal choice really depends on a person's circumstances, including the nature of their sleep problems, including overall health and coexisting conditions, and including what other medications they're taking. So at least there are some other important factors when making a choice. And given the multitude of factors that can inform this decision, it's best to talk to your doctor before taking a sleep aid, including those that are sold over the counter as a dietary supplement. The possible downsides of sleep aids are, well, first of all, can they make me have a habit? Will I have to take this forever to go to sleep? Will they ever become not effective? Can people build up a tolerance to these sleep aids and reduce the benefit that it potentially had at one point, and or worsening any side effects if the dose is increased? Sleep aids, can make you feel groggy, and being too groggy in the middle of the night, let's say if you have to get up to go to the bathroom, can of course put yourself at increased risk of falls or accidents throughout the night. And, accidents only get worse as we get older. So sleep aids also may cause the next day drowsiness. So the effects of sleeping pills can carry over to when you're awake. And we know that this can impact our alertness when we're driving, for example, and can be similar to something like driving drunk. Sleep aids can also contribute to complex sleep behaviors. So some sleep aids like Ambien have been reported in rare cases, but it has been reported that people will still be kind of sleepy, or they don't even know they're doing it, but they can drive, they can eat, they can, do other things, which are probably not safe because you're, kind of like in a zone with the influence of the medication. So drugs may interfere with sleep quality. Finding the right one, of course, is going to be very important. And it can, of course, impact, the progression of how you go through the sleep cycle, which I talked about in the prior slide. But I also want to point out that, I think it's important for everybody to know, everybody on this talk, that, drugs, sleeping pills are linked, certain ones especially, linked to increasing your risk of developing dementia and or Alzheimer's disease, especially if you're at risk for this condition. And so, women, 1 in 5 women will go on to develop dementia. That's the stats. That's how it is right now. And so, if you're a woman who also can't sleep and you're taking Benadryl at least 4 times a week, are you putting yourself at risk for damaging your brain? And, the other thing I want to share is that 2 main drugs especially have been shown to have this greater risk. And so I talked about Benadryl just a little second ago. So those are in the family of what we call anticholinergics. And then something in the class of anti-anxiety medications, what we call benzodiazepines, are also a higher risk category medication, which can increase your risk for developing dementia. So I can definitely not afford a bad night of sleep. Actually, none of us can, right? Sleep impacts every organ system and every disease state. So, if you have cancer, you might not sleep well. If you have a menopause, you might not sleep well. So poor sleep has become very common, unfortunately. We go to bed late and we try our best to wake up early, burning the candles at both ends. You've heard that expression before. But sleep also impacts the glymphatic system. So this system removes waste that accumulates in our brain. I love this glymphatic system. I'm a very huge fan because why, you may ask? What happens every night when you sleep is the spaces open up in our brain. And when you sleep, only when you're sleeping, it's like this shampoo that comes out and gets rid of toxins. And you want the full shampoo every time you sleep. And so hopefully you're sleeping over 7 to 8 hours and you can get that full shampoo. So when you're sleeping, the glymphatic system is getting rid of those toxins, or what we call beta amyloid, when we talk about dementia. So can you honestly answer to yourself, and we can talk about it when we open it up for question and answer? Do you sleep less than 6 hours or maybe even more than 9 hours routinely? So in this study, I want to share with you 67 sites. That's a lot of sites. It was included United States, Canada, Australia, and Japan. So we got, multi-diversity here. And they looked at individuals aged 65 to 85 years. And they also did PET scans on these patients. And they tested apolipoprotein E genotype. And these patients did not have any kind of memory problem. So what do the results show? This study found that those reporting 6 hours or less of sleep had elevated levels of brain amyloid compared to those getting 7 to 8 hours of sleep. And if you slept more than 9 hours, you had a higher chance of having lower cognitive or executive function, as well as is the word. So just the processing skills of your memory definitely were lower if you slept more than 9 hours routinely. So what's the significance of this study? Well, we have known that, less than 6 hours of sleep is not good for us. But the size of this study and the many locations, 67 sites, really got us a good flavor of proving that this is what's happening, and the PET scans verified it as well. So from a nutrition perspective, what should we be thinking about to help us go to sleep? It turns out what you choose to eat is an important factor in determining how well you sleep. An overall healthy diet is important for good sleep, as well as an all-around good health. Makes sense. What are the healthiest foods to eat? Well, we should be having plenty of water, keeping our body hydrated. I like to use the kind of rule of thumb of like half your body weight in ounces. So if you weigh 100 pounds, you would try to drink about 50 ounces of water, as well as whole unprocessed foods. So, this slide is kind of showing you whole foods, and it's nice to aim for those balanced, nutritious meals, or shall I say like a Mediterranean diet. Speaking macronutrients here. So, you want to focus on the complex carbohydrates, you want to focus on healthy protein, good fats, olive oil, to get your omega-3s, plant protein from legumes and grains. It's also good to have fermented foods and probably sprouted grains. And so here in this study, proving it on real people, half the participants were good sleepers, while the other half of the participants were poor sleepers. And the good sleepers had a significantly higher adherence to the Mediterranean diet, which can lower your body mass index and waist circumference. And if you sleep well, you can eat well. And if you eat well, you can sleep well too. It's just kind of showing us that there is this nice bi-directional relationship. And what should we not see in the diet, right? Ideally, we don't want to see chips and crackers, candy, soda, processed foods. Ideally, no frozen meals, although you can find some brands that don't have the additives, which make frozen meals bad. No refined flours and no refined sugars, no hydrogenated fats. You really want to watch your peanut butter supply for this. Avoid artificial colors and sweeteners, and you want to try to be pesticide free. So many of you already know that when you eat poorly, such as when you have more saturated fats, this may lead to more inflammation. And that's kind of what's being said in this slide, right? So you eat unhealthy fats and you can lead to more inflammation. So with all that being said, I am human, and I expect that we are all human, and it's okay to indulge at times, but none of us are perfect. I'm not perfect, but we want to try to eat as clean as possible most of the time. So This slide, another study, just to kind of tell us what not to eat. Since diet plays a significant role in inflammatory markers and sleep quality, this study kind of showed us that. There was a plant-based diet with inflammatory markers and sleep quality measured. And they looked at it in 380 women aged 18 to 48. And what these results, the findings indicated a significant association between adherence to an unhealthy diet leading to inflammation and poor sleep quality. So what do we already know about this topic? Well, we already know sleep is an essential part of life, and sleep quality has significant impact on individual well-being and performance. There is a bidirectional relationship between disturbed sleep and elevated levels of inflammatory markers. Diet plays a major role in sleep quality and its related health consequences. So what does this article actually add? It really shows us that, again, healthful plant-based diet is associated with lower level of inflammatory markers, with adherence to an unhealthful plant-based diet, that you have a higher concentrations of inflammatory markers and there's lower sleep quality. So what you do during the day impacts your sleep. And I just wanted to kind of, show you the full circle, because that is what we tried to do here today. We talked about what happens during the day, what happens during the morning, day, evening, and at night, and how that all now relates to sleep. So I just stopped sharing my screen, and I would like to take some time to answer any questions. And of course, all of the panelists, speakers will join in on this.
Thanks so much, Samida. That was an excellent talk. I love the in-depth discussion with diets, and it's so interesting. One of my friends is a lifestyle medicine doctor, and she just posted about how the plant-based diet specifically can help with vasomotor symptoms during menopause, so hot flashes. So, maybe if you're a woman having difficulty sleep because of your hot flashes, right, consider how plants can actually help support the menopause symptoms, but also support your sleep. So fantastic. I think the first question was actually my question for Amanda, and it's something that I get asked pretty frequently. It's, what are your thoughts about exercise later in the day, and how close can we exercise to bedtime? So like, what if I'm not a morning person? I work a full day, then I got to get the kids and the dinner going. And by the time I have time for myself, it is probably 7, 8. Is it okay to exercise, and then what type of exercise? So just curious what your thoughts are there, or anyone on the panel as well. So just want to open it up. Thank you.
Yeah, it is a really interesting question, and one that's asked a lot. I think we've got such busy lives. We need to fit exercise in where we can, so where it's going to work. So if you can't put exercise into your morning routine, which is, as we've talked about earlier, it's optimal for really kicking that circadian rhythm with that temperature rise. But yeah, evening exercise is, in my view, and I'd love to hear from the rest of the panel, but in my view, it's not great. There's a lot of individual variation to how people respond to exercise in the evening. But I usually recommend not to exercise within 60 minutes to 2 hours of bedtime. But I do know people who can do that quite easily and fall asleep. They're generally people who are extreme athletes, and they're probably just so physically tired that they get to fall asleep. But yeah, that's really sort of my recommendation is, yeah, try and do it in the morning. But if the evening works for you, well, then yeah, just do that, as long as it doesn't upset your sleep. Nishi, Samida?
Yeah, so this is a question I get asked all the time as well. And, I'm a bit more of a night owl. I'm kind of medium, but more of an evening person. So I'm definitely not waking up at 5 a.m. to work out. It's just not happening for me. So there was a really interesting study in the Sports Medicine Journal. I think it was like 2 or 3 years ago. And they actually tried to answer this question of, how late is too late to exercise? And what they found, and so this is like an analysis of like 20 different studies or something. And so what they found was that moderate exercise within an hour of bedtime is not is it not bad for sleep, it actually might help people sleep. So it might help them fall asleep faster and actually have more deep sleep. However, vigorous exercise within an hour of bedtime does affect sleep quality. So it makes it harder for people to fall asleep and stay asleep. So vigorous exercise is exercise where it's hard for you to talk. So if you're like running really fast or something and it's hard to keep up a conversation, that would be considered vigorous exercise. But if you're doing sort of light to moderate exercise, where it's like you can still do your workout and you can talk to your family or buddy or whatever, that's okay. Up to like Amanda said, about 60 minutes before bedtime. And one of the reasons it's been thought for so long that exercise is close to bedtime is bad for you is because it raises your body temperature. And as we looked at before, a lowering of your core body temperature is necessary for sleep onset. But it really comes down to the individual. And so, is it better to skip your workout in favor of sleep, or should you like do your workout if it's going to affect your sleep? It's always a balance. But I recommend to people, if you can do some light to moderate exercise in the evening, that's okay.
I would agree. I think, certain exercises like yoga or maybe just a light evening walk, might be just relaxing enough, but not too vigorous. And so it might help kind of unwind you and shake out if you have been working all night. Some people, do go to the office, come home, eat their dinner and then go back to work. And so just to kind of shake it out a little bit, sometimes I think a lighter exercise might be okay. But of course, as we heard from Dr. Val, that, even 2 bags of black tea can make her not sleep. It's a very individualized, right? So same with exercise. I think we just have to figure out what's right for you. Of course, we don't want you hurting yourself, get into a wrong twist or something like that. And then now you have back pain and can't sleep. So, be careful, but yes, we encourage movement, and earlier is better. I am that early morning person. So, I like to do it in the morning. I like to get my exercise in the morning.
There's a question that's come up in the chat from Pam, and it was actually a similar question to what I had sort of put, if no one else had a question, and that is just about waking up in the middle of the night. She's saying she's got a problem falling asleep, but wake up after 4 hours and can't go back to sleep. And I guess it's that going back to that, that sleep drive, it builds during the day, but then as we sleep and we get to that sort of 3 o'clock, 4 o'clock in the morning, and that drive is starting to drop off, what can we do to really optimize our sense of, our state of sleep, so that we don't, because we're quite vulnerable to waking at that time, whether it's a snoring partner, it's a dog barking, and I think it's because we don't have such a strong drive for sleep at that time of the night. So yeah, maybe Val, if you want to kick that off.
Oh, sure. Well, going back to, I always like to look what's the underlying cause. So, get curious about it. Is it because your, homeostatic pressure isn't as strong during that time? So if that's the case, right, I mean, a circadian rhythm should be kicking in, but, were you exposed to more light in the early evening? And maybe that's why, your melatonin has been delayed or not released. Or potentially, is it undiagnosed obstructive sleep apnea, right? During the later half of the night, we have more REM sleep, right? REM is a part of the night when we're having more active dreams, so our bodies are paralyzed, so we don't act out our dreams. We know women have higher rates of, higher apneas, during REM sleep. So potentially it could be that. Another one that's sort of interesting that, I need to actually look at the data, but I've just been hearing anecdotally from some friends is, they're wearing continuous glucose monitors, right? And so are you waking up, right? Because let's say you had dinner, I eat dinner between 5:30 and 6 because I've got young kids. And then, by the time it's 3, 4 a.m., is my, my sugar tanking and then my cortisol levels rising, but it's still too low that, maybe I need to wake up and need something. So, those are certainly things to consider as well. And then, there's always that big S, the stress, right? You're waking up, you're a little bit lighter, you're not as sleepy, and then your brain is still sort of active. You sort of got that hypercortisol, that adrenaline going. Maybe part of it is, not breathing. Maybe part of it is, your blood sugar, but maybe it's a little combination of everything. It's just the perfect storm where you're up and alert, and then now what do I do? So, find an activity, find a good mind body practice that can relax you. But also sometimes I think of it as you get that gift of time, right? Sometimes I love it when a meeting is canceled because then it's like, oh yes, now I have another half an hour. Being a mom who's also busy, sometimes it's nice to have that quiet, that stillness in the night, whether it just, to do a meditation, to do some journaling, or actually even to be on my phone. I mean, I know, right? You probably should be on your phone in the middle of the night, but if I've already gotten, 5 hours, you're going to be okay the next day, right? I mean, everyone stayed up late at a party, at a wedding, and, you probably were a little bit tired the next day, but since it was associated with a pretty fun, activity, you're not really going to be dragging as much as, if it was, night after night of having, disrupted sleep. So that's sort of my take on that.
Anyone else want to add to that, Nishi?
Sure. No, I think Dr. Val kind of covered it all, but yeah, I mean, I would echo that. You want to look at the underlying causes and determine, okay, yeah, is it sleep apnea? Is it periodic limb movements, or which is related to restless leg? Is that waking you up? Is it something in the environment? Is it your partner who's snoring? Is it your blood sugar fluctuating? And so this is where like having a high fiber snack about an hour before dinner can be helpful, just to kind of keep your blood sugar levels stable, like some carrots and hummus, that type of thing, especially if you ate dinner earlier. And then you want to make sure that and this is easier said than done, but you want to make sure you're not getting too stressed out about those awakenings, because it is normal for us to have awakenings after our sleep cycles during the night. And as our sleep drive goes down after 4 or 5 hours of sleep, you're more likely to have an awakening. And so it's not the awakening itself that's problematic in many cases, but it's how we respond to it. So if we're starting to get really anxious about it and thinking like, oh my God, I'm awake again, why does this keep happening to me? And now I have to wake up in an hour, and what am I going to do? That can perpetuate the cycle of waking up and the cycle of insomnia. So, once you've addressed and figured out the underlying causes, you also want to make sure you're addressing your thoughts about it. Like as Val was saying, like 3 or 4 in the morning is actually a very sacred time. And in yoga, that's like considered the best time to meditate, because it's kind of the twilight state between, our physical world and the metaphysical world. So there's almost a beauty in sort of reveling in that time of the night, if you want to kind of get a little metaphysical with it. Another thing I would recommend though is tracking your sleep. So you can use a pen and paper sleep diary. I have an Oura Ring. That's what I use as my sleep tracker, as long as you don't get too obsessive about it, but you can sort of track it and just see, are there any patterns that you can identify as well.
There's a question from Pam about alternative ways to treat sleep apnea without a machine. So who wants to take a stab at that? I don't know, Samida, if you want to talk.
I have to say that my bias is that the sleep apnea machine does work the best. I find that from a safety perspective, and other than this, machine recall, but in general, the safety of using a machine, I don't have any other side effects that that patients get. Once we find the right setting and the right mask, there's a few things that need to kind of go into that part of it. But, I think they are, I think in certain patients, if you have a more mild case of apnea, a dentist can fit you with a mouthpiece. Some problems with that is that it's shifting your jaw, and you might end up having a bite change over time. So that's a bigger problem that I don't like to happen. And so that's why I guess my bias is more towards that CPAP machine. But that is a possibility. In more moderate or severe cases, there is a surgical implant what we call the Inspire device. And so that is a electronic device that's kind of implanted inside of you. And so when you're going to sleep, it gets turned on, try to help open up your airway for sleep apnea. So they are talking about using things like CBD for sleep apnea. So using marijuana, it's not available for clinical use right now, but the fact that they're looking at some oral choices to try to sleep apnea, to try to treat sleep apnea, is hopefully in the works. So. Anybody else want to add anything?
I was just going to say,
should we try to get through all the questions, or sorry, go ahead.
Yeah, I just wanted to add the lifestyle factor around sleep apnea, if it is associated with weight.
Right.
A really important one to look at is, if it's associated with obstructive sleep apnea, is to lose weight. I think that's just a really important thing that we can't forget. Interesting you talk about is it mandibular shifting, something or other? I was talking to a dentist a few weeks ago who builds these, and she said that they do recommend regular dental checks because of that shift in the bite. And I just wanted to just say how funny it is, every time I go to the pharmacy or the chemist, I don't know what you call them in the States, there's a new device to stop snoring. And of course, snoring is associated with sleep apnea. It just blows me away. Yeah, crazy. Sorry, you had a question there, Val?
Oh, no, I was just saying, should we try to get through all of the questions here? Because Lauren, hopefully she's still here. Thanks for everybody who's still on the line here. If you're sleeping at a fairly regular hour most of the week, how much do 1 or 2 nights, significant later nights, impact sleep overall? Does it totally throw off good habits? What do you think, Amanda? 1 or 2 nights? Is it okay to eat ice cream and cake on your birthday? That's what I or is it, no, you have to be plant-based 100% of the time? What are your thoughts there?
Sorry, was that a question for me?
Yeah, if you want to address it, what do you do if you're doing pretty well, then 1 or 2 nights, you have a hard time? What do you think of that? Does that really throw things off? How does that affect your health?
Okay, sorry, I was distracted by the legs in the background.
Oh yeah, no worries.
Yeah, look, my thoughts around that is again, it's not, don't get hung up on it. We need to aim to, for me, I'm trying to exercise, do 5K 3 times a week, but I'm not going to, be really hard on myself if I miss one of those runs. I think in terms of how it affects our sleep, if you can't do whatever it is you want to be regular with your sleep, whether it's you go to bed time or your wake up time, or if it's 7.5 hours that you need every night. I don't think one night is going to throw you off. I think it's when it starts to become more regular that your habits start to shift. And our body's so habitual that they want some sort of consistency. So if you're starting to consistently wake up half an hour later, well, your body's going to want to do that consistently. So yeah, we don't want to fall off too often, but like I said, someone said earlier, if we're we are human and we enjoy life, and sometimes things get in our way. I had a dreadful sleep a few weeks back where I injured my shoulder and I could not sleep, so maybe 2 hours of interrupted sleep during the night, but that didn't throw me off completely. Like, I had a really bad night. So yeah, I think it's just be kind to yourself, work towards all these wonderful behavioral approaches to optimizing our sleep. And from what we've presented today, I think it's really important just to take that on board and know that you can influence your sleep and optimize it for that well-being and that performance piece. But don't get too hung up on it. It's back to the sleep trackers. As Nishi said, people get so fixated on sleep trackers, but really, how are you feeling when you wake up in the morning? That's the ultimate thing. Yeah. I hope that answered the question.
Yeah, thanks. So I think our final question, I mean, I had some questions, but that's okay too, because we're getting a little late here. Any tips for good sleep in dark environments? This is from Grace Lee. Just moved to Alaska and it's dark until 10 a.m. So I feel like my sleep cycle is all off. I see Nishi shaking her head. I know she's lived through different parts of our country, the East Coast, West Coast. I've been pretty spoiled. I've only lived in California and Hawaii, so I'm not too familiar with seasonal affective disorder or darkness. So I don't know if Nishi, you want to take this one, or anyone else.
Yeah, no, I'm happy to take this one. And I mean, this is, yeah, I mean, yeah, I grew up in the Pacific Northwest, and I've lived in parts of Europe that were very dark, and yeah. And I see a lot of patients who experience circadian rhythm issues and seasonal affective disorder. And I'm now in the Bay Area, and it can be very foggy and dark, but maybe not quite as dark as it is in Alaska. So what I would recommend is a couple things. So light therapy boxes are very, very effective, both for regulating your circadian rhythm and also for improving your mood and reducing symptoms of depression and seasonal affective disorder. And you might want to consider two different types of devices. So one is a sunrise alarm, which is essentially kind of a globe-shaped device, and you set it for the time you want to wake up, and it simulates a sunrise in your bedroom. So that's a nice sort of way to set your circadian rhythm and help you wake up more gradually to this simulated sunrise. You may also want to consider using a light box or a light therapy box, which is a device usually about the size of an iPad. They come in bigger sizes and smaller sizes, so you can look at what would work for your space. But a light therapy box gives off bright light, usually about 5 to 10,000 lux, L-U-X, intensity. And that can really help to uplift your mood and kind of reset your sleep-wake cycle. And you want to use that in the morning. So if it's dark until 10 a.m., like you'll want to use that before 10 a.m. for about 15 to 30 minutes. You don't look into the box. It's like the sun. You don't look directly at it, but you have it about 2 feet away from you in front of your face. So the light is bathing your face and it reaches the retina at the back of your eye. And you just do that every morning around the same time. You want to make sure that if you do get a light box, that it has a polycarbonate filter, so it's filtering out UV light. Most of them do, but you just want to check for that.
Awesome, thanks so much. Any other questions from the audience? I know it's getting late. All right, I had one last question if we're okay. I don't know, I think you had a question too, Amanda, but I wanted to ask Samida or anyone else here is, I've read a lot or just a lot of people on social media talk about deep sleep. Am I getting enough deep sleep, or how do I get more deep sleep? And is this something that I can control? So can I up the levels of my deep sleep?
What are we measuring it on? Are we just measuring it on how we feel, or are we using a tracker to know what deep sleep is? Is that what you're kind of referring to in the question?
Yeah, I mean, some people use trackers, but I mean, yeah, I mean, how do we get more slow wave sleep, I think is the question. But yeah, I mean, I don't know how people are really tracking it if they're using, their Fitbit. Is that truly deep sleep? So yeah, or is this something we can't even aim to get more of?
I would have no idea how I sleep unless I had some device, right? So I would just wake up in the morning and decide, did I sleep well or not? The devices, the Oura Ring, I don't have. I have a Fitbit, and I'm not sure that the Fitbit is accurately counting, how much time I spend in deep sleep. And that's been verified through studies, that it's not as accurate like a sleep study when we put electrodes on our brains and, try to compare it to something like that. The Oura Ring actually in the studies was a little closer to what a sleep study would show. And so if we're comparing it to that, then that's one way to track it. And so, I think for me, how I get deeper sleep is I find exercise helps me get a deeper sleep. And so that's what I would, recommend, that if you're feeling like you are not getting deep sleep or not well rested in the morning, you have to kind of ask yourself, are you exercising? And if you are exercising, can you push yourself a little bit, so that, I don't know what you're doing, but let's just say you're walking, can you push yourself, to kind of up your heart rate a little bit? Can you push the intensity of the walk, like a little speed walking and slow down, walk, that kind of thing. Just kind of change up the muscle memory of it, and seeing if that can help you get a better night of sleep as well. So I'm not telling you to go become a marathon runner to, get deep sleep. I'm just saying, in the time frame that you have allotted for yourself to exercise, challenge yourself a little bit and see if that gives you what you're looking for.
Oh, that's a great answer. Thank you.
It might be just, the others might want to add to this, but just the idea of, deep sleep. We spend more time in deep sleep in that first half of our night. I like to think that if I need more deep sleep, and of course it's my Oura Ring or my Apple Watch that's going to tell me that I haven't had enough deep sleep, because otherwise I don't know. And whether or not I can rely on that, who knows? But if I want to have more deep sleep, I think absolutely exercise helps me personally, but also going to bed earlier, like shifting my routine. So I really make sure that I get some really good sleep in those early hours of the evening rather than, pushing my sleep later. I don't know if there's any science behind that.
Yeah, I mean, I just try to keep my sleep routine, because for me, the earlier question was, can we get away with having later nights, 1 or 2 nights a week? If it works for you, I guess. But, for me, I'm such a hard wire. And as I get older, I feel like it's even worse for me. Like, even shifting, if my bedtime is 10 and I go to sleep at midnight, like the next day I'm feeling it. And so of course my eyes just wake up, so I can't really sleep in, even if I just lay in bed. And so for me it's impactful, right? So trying to be consistent with sleep, of course, is something that we would recommend. All of us would say that. And so if you are tending to drift into later nights, yes, pull yourself back to your routine. And I think that might even be a nice, helpful, just to make sure you're getting enough sleep too.
And I'll just quickly mention about social jet lag. I know we're kind of running a little bit late, but I'll just mention that because it really pertains to what Samida and Amanda were just talking about, which is, so social jet lag is essentially like jet lag that you get without traveling. So it refers to a jet lag effect from having a different sleep schedule on different days. And so we do get more deep sleep in the first half of the night, more REM sleep in the second half of the night. And so if your sleep schedule is fluctuating, and we see this with people who are like shift workers, but if you're, getting up at 6 a.m. on work days, Monday through Friday, and then getting up at like 10 on weekends and going to bed much later, that's like a 4-hour time difference. So it's like you're going from, California to Hawaii or beyond, like every weekend. And so what's going to happen is you're going to cut off that deep sleep when you're going to bed later. And then when you're getting up earlier, you're going to cut off some of your REM sleep, just to put it very simplistic in a very simple way. So having a very consistent sleep schedule that's within about an hour. So it doesn't have to be perfectly, on time every single night. But if you're getting up around an hour of the same time every day and going to bed around an hour of the same time every day, it's going to help ensure that you're getting all of your stages of sleep.
Wonderful. I think it's pretty fascinating that we're going on to an hour and 45 minutes, and the majority of participants are still here. So, I mean, it's almost 6 o'clock where I am, so I know it's much later for some of you folks. And I just put in the chat, type Y if you want us to continue doing it. So we already got 4 Ys. So thank you so much. This was our first time. I'm really glad for everyone to be here. And I think probably we'll send out some of our contact information, some of our emails, how you can get a hold of us later on. And then, yeah, please give us any feedback, what you enjoyed learning about, what you didn't enjoy, what you want to hear more about. And yeah, we can convene as the Sleep Divas and provide more value to you and help you get better sleep. So thank you so much, everyone, for coming.
Thank you.
Yeah, and
Thanks,
it's recorded,
everyone.
right? So if, we can share this, and if anyone wants to share it with your friends as well, please do. Thank you.
Fantastic.
Thanks, everyone.
Bye.
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 think if I end it, I'm going to close everyone out. So see you ladies later. Bye-bye.